Hey, folks, if you haven't done so already, please click that subscribe button below. That'll help us grow as a show, attract better guests. Together, let's make healthcare better for everyone. Once again, click that subscribe button. We'll see you on the next one.
Get ready to take control of your healthcare. Here's your host, Ray Cober.
So, give us a flavor. How many employees are you responsible for?
About 2,000.
About 2,000. So 2,000 employees, plus their families. I would imagine that's over 3,000 lives,
Right.
somewhere in the 3 to 4,000 range that are actually covered on plan. And, that bears with it a great weight of responsibility. And I think you'd agree, most HR professionals take the business of healthcare very seriously. What was it about what you were doing prior to what you did that kind of got your attention? What was kind of that moment where you said to yourself, and what were you doing before you made the moves that you did? Because you were one of the featured speakers at the conference, and you were there to kind of share your story. So if you would kind of take us back to, when you got into this role, what were you looking at? If you could describe your primary function, like what were you tasked to do when you landed in the role, and how did that evolve, and how did this eventually get your attention and get on your radar?
Sure. So when I got in the role about 15 years ago, it was a little bit different of a position. It was more reactive than proactive. And so we counted on our brokers a little bit to be giving us the direction we needed that would help us maintain control of our costs of the health plan. And as we saw that wasn't working, as we saw that staying the course to what everybody else was doing wasn't working, we saw our surplus diminish. We had a $5 million surplus at the time, and it completely went away. Our controls were getting tighter. We had all of the controls that were being recommended, whether it was on the medical side, on the pharmacy side, and we were even being slightly progressive towards my 5th year in. We were contracting direct clinics to try to have a discount from what our contracted rate was under our TPA, our carrier. And so that was helping us a little bit, but again, not making any big moves. Meanwhile, we were cost shifting. We were doing a lot of cost shifting to the members. And so that was coming in ways of co-pays and co-insurance, as well as premiums. Our satisfaction was dropping dramatically. The running joke is that, I was afraid to go to my car at night because I was worried that, somebody might have slashed my tires. And I know it's a running joke, but there was a real fear because we had such dissatisfaction among our membership at the time. And so that's when we knew it wasn't working. Following all of the recommendations, doing all the tight controls on the plan, it still wasn't helping us. And even though at the time we were better than book of business, and our TPA would show us that we were way better than book of business on medical, the same thing with pharmacy, it still wasn't changing the budget. And the budget for the City of McAllen affects our taxpayers. So it's not only premiums coming from our employees, but it's taxpayer money. So it wasn't making a difference on the overall budget.
Did your journey kind of end with direct primary care, or are there other cost containment strategies that you've deployed kind of since that? That was, I'm guessing, the first domino. What else are you doing to control costs?
So we've definitely grown the cash pay negotiation using our DPC provider as the conduit for that. But one of the other things that we've done is international sourcing of our pharmacy. That alone in 1 year saved us almost $600,000. Just taking the same drug that people were getting from the local pharmacies and sourcing them through international, which we also gave a rebate for the first year of our employees filling it through the international pharmacy. So there was an incentive for the employee, and we were getting anywhere from 30 to 70% discount on the pharmacy fill itself. We continue to look at things, in plan design, making sure that our overall strategy is consistent with again trying to make sure that the access is there, making sure that the financial liability is at its minimal that it can be for the plan member. But right now, I think, the turn of events with the direct primary care, that's where we're seeing the financial savings right now. And so we're definitely continuing to, reach out to those that haven't used that program yet. We're running at about 66% increase in primary care utilization since we launched. We have about 60% on average of our members that have utilized the direct primary care in some way, including the cash pay negotiation for the ancillary or the referrals. But really, monetarily, that's something that we're really focused on with the DPC and that program right now, strictly because we're seeing things like a 4% decrease in medical spend by the second year, which that was against inflation. That was just unheard of for us. We haven't seen it go down in the 15 years I've been here, except for that second year of the program.
Well, I'm going to put you on the spot, and you don't have to answer. But what plan? What path do you choose?
As far as going through the direct primary care?
Yeah.
Well, of course I'm there.
I mean, couldn't that say it all? This is what you do for a living. Like
Right.
you're the chief architect of this plan, essentially, and that's the path that you take. So that speaks volumes.
Right. And I did have a provider that I thought I knew very well that I had used for 15 years. And as much as, it was sad to see, me go this route, I knew everything that was in it for me, and I knew what was in it for my family.
Yeah.
And so, I had to do what was best for me and my family.
100%. And so does the DPC also offer virtual, teleconferencing and
Yep.
phone consultation, or do you have to show up to a brick and mortar facility?
No, it has all of those options. So, you can get things sent, your lab results sent to you by email. You can have a virtual visit over them if you want to talk about them, or you want to get a summary via text. You can get that way. It's whatever the preferences of the member. And we have members that are technologically savvy, and we have members that are not. So the members that are not technologically savvy, they prefer those in-person appointments.
And what about pediatrics or OBGYN? Does the DPC handle that as well, or is that outsourced?
Yes, they do. So they do both women's healthcare as well as pediatrics. The one thing that we're growing in is the fact that we haven't been able to sustain enough of the pediatric vaccinations. So while we can do all the pediatric care, the vaccinations right now are something that we're trying to see if we can do a campaign on to remind people about that we can do pediatrics, so that we can actually sustain enough to have the inventory of the vaccines on hand at any given time.
Wow. Very, very cool stuff. And so let me ask you, what do you see for healthcare moving forward? If you had a crystal ball and you said, well, here's where I think the country is heading, and here's where I think we're heading, because we have somewhat control of our own little ecosystem. But what do you think the bigger picture is? If you hadn't gone down this path, I think you said there was $8 million in savings over the course of the past 5 years. What do you think that'll look like 5 years from now?
Yeah, I mean, I can only assume that savings trend is going to continue, and I'd actually like to see it even grow further. Just again, trying to attack that 35% that's not utilizing the primary care at this current time. As far as the crystal ball as to what healthcare is going to look like, I see us fighting for more transparency. I see there being such an angst and anger towards the fee-for-service model, and especially on the PBM side, the money that is flowing into so many places that we don't get to see. And I think that you're going to see a real change coming in the next, over the next, I would say next 4 or 5 years, where people just get out of the model altogether, and they go cash pay, and they find other ways to bundle things that don't include this, especially on the pharmacy side, muddy waters of where all the money is going. On the medical side, it's a little bit more clear where the money is going, but under the fee-for-service model, we're not going to be able to make a dent, and so I see that model going away.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.